Good afternoon. Thank you all for joining us today in what I know will be an engaging and informative session. I am Lorna Hankins, Executive Director of the National Kidney Foundation serving Texas, and it is my honor and privilege to share this platform today with two esteemed partners and friends in the fight against kidney disease. Please join me in welcoming our esteemed panelists. Dr. Frida Fisher, affectionately known as Dr. Frida, is the founder and president of her own nephrology practice, Midtown Atlanta Nephrology, and she is the medical director of a nonprofit dialysis unit. Dr. Frida completed her internal medicine pediatrics residency at Georgetown University Hospital, and she completed her nephrology fellowship at Emory University School of Medicine. Dr. Frida is board certified in nephrology, internal medicine, and pediatrics. Also with us today is Gary Patingalo, who is a master's prepared social worker who has completed rigorous coursework, supervision, and training as a qualified MBSR, mindfulness-based stress reduction teacher through the Center for Mindfulness in Medicine, Healthcare, and Society at UMass. Gary is also certified to teach MBSR through the Mindfulness Center, Brown University School of Public Health. Gary has co-founded Mindfulness on the Rocks, committed to providing gold standard evidence-based mindfulness programming in Northeastern Ontario, Canada. Thank you both so much for joining us today to discuss COVID-19 vaccines and pandemic fatigue. Before we get into the conversation, I want to remind you viewers to please enter your questions into the chat room throughout our session today. So Dr. Frida, you deal with kidney patients all day long. Is there specific information about COVID-19 vaccines that people living with kidney disease should be aware of?
Absolutely. Thank you, Ms. Lorna. So there are some specifics. A lot of my patients, when they first found out about the vaccine, well, they were concerned. They say, well, we have chronic kidney disease, or we're on dialysis, or we have transplants. Maybe we shouldn't get the vaccines. Maybe they're not for us. But nothing could be farther from the truth. Kidney patients are actually at a higher risk for getting the COVID-19 infection. Kidney patients are at a higher risk for being hospitalized with it. And unfortunately, kidney patients are at a higher risk of having severe complications from COVID-19 or even from dying from COVID-19. And so absolutely, we recommend that our kidney patients, our transplant patients, our dialysis patients all get the vaccines. Now, there are some important things to note. The vaccines give us an awesome protection. And in the studies, we saw that two of the vaccines, the Moderna and the Pfizer, can give up to a 95% protection. And you get an excellent protection from Johnson & Johnson as well. All three are shown in the trial to protect us and protect all the patients from having severe illness or hospitalization. But no vaccine is 100%. No vaccine is 100%. And so it's still important for kidney disease patients to wear masks, to socially distance, and to really use good judgment in the mitigation factors and staying safe in this pandemic.
Thank you. Thank you so much for that, Dr. Frida. You know that as we have that opportunity to be vaccinated, it sometimes seems and feels like it's harder for us to maintain those practices that have kept us safe thus far. We may let our guards down a little bit. We may not be as attentive, to those protocols that have helped us stay safe. Gary, with that melee setting in, could you please provide an explanation of pandemic fatigue and talk to us about how we can overcome that?
So I always think that pandemic fatigue was kind of like having a dark cloud above you all the time. And this dark cloud has been looming since about 14 months now. So people are tired. And as far as pandemic fatigue, it really is associated with living in chronic malignant stress over a long duration. Our sympathetic nervous system is revved up, and we're seeing things very tunnel-like, kind of myopic. So we're not seeing things as clearly as we'd like to. The tiredness, is just one of the symptoms of pandemic fatigue. we might find that we're more irritable, and that can go with a whole host of other things. It's much more common that we're living in together with different generations now than we have in the past. So there's that lack of being alone, which they're referring to as loneliness. But anyway, there's a lack of motivation. We might feel that we're just less productive than we'd like to be. Might be hard to get up out of bed in the morning. But it's not a full depression, but it's just this general malaise kind of that just is dampening our quality of life at this time. Our sleep might be disruptive. A lot of us are dreaming about what I refer to as COVID dreams, maybe being in a crowd, and suddenly I've had them myself, and suddenly you realize you don't have your mask and how disturbing that is. We might have changes in our eating, maybe eating a lot more junk food and just not paying attention to nutrition. And we might be more forgetful. I bumped into somebody the other day, and they said, I wanted to talk to you about something, but I couldn't remember what, and I keep forgetting a lot these days. So these are just some of the signs and symptoms of pandemic fatigue, which, like I said, is really normal given the extraordinary abnormal circumstances that we're living in and the long duration that this has gone on. The difficulty, as you said, Lorna, is that it might cause us to let our guard down. It might cause us to be more reactive as opposed to responsive, and to act with less wisdom than we typically might. And we might do things that are more chancy that might get us into trouble.
Absolutely. Thank you for that. And I know that many who are watching are probably thinking about how, one determines that you're at a point where that's not, your normal sort of angst, and it's reached a level where you need to have, some sort of assistance or guidance in terms of managing it. So again, one of the reasons that we're so happy to have you with us today. So thank you. Thank you for that. Dr. Frieda, did you want to weigh in on that at all?
Just that it's so real, and what I'm hearing and seeing from day to day, the pandemic fatigue, and especially for people who are used to being upbeat and they haven't had any kind of issues with mood or memory, it's very new and challenging to a lot of people, this pandemic fatigue. And so I'm really glad that you're here, Gary, to bring light to it.
Excellent. Well, I think that we're probably going to be able to share a lot of information by going to the questions in the chat room. So I'm going to go ahead and start with that. And so my first question, and Dr. Frieda, this is directed to you. The FDA has deemed that the COVID-19 vaccine from Johnson & Johnson is safe. Is the Johnson & Johnson vaccine safe for those people living with kidney disease?
Yes. So the history of the Johnson & Johnson vaccine, when it first came out, we were all very excited about it because unlike the other two vaccines, which require 2 separate shots, 3 weeks and 4 weeks apart, the Johnson & Johnson vaccine is a one and done. And it has a great efficacy as far as preventing severe hospitalization, severe illness and complications from COVID-19. And it can prevent you very nicely from dying from COVID-19, the Johnson & Johnson. But of course, we recently had a setback. And because our monitoring system, our safety protocols are so stringent, we were able to catch 6 cases of ladies between the ages of 18 and 48 who had a very rare blood clot, very, very rare. Now, when those 6 ladies were identified, at that time, approximately 6.8 million doses of Johnson & Johnson had been administered in the United States. And that meant that we had about a 1 in a million chance or correlation to have this very rare blood clot with Johnson & Johnson. And so, of course, that's very scary, any kind of blood clot, but 1 in a million chance. What is so wonderful about the FDA and the CDC and all of the administrations involved with the safety is that they honestly do put safety and transparency first. And so this 1 in a million correlation, they stopped everything, looked, did the research, and really wanted to make sure that doctors knew how to recognize this clot, and they wanted to make sure that there weren't a whole lot of other cases of this type of a blood clot. And they did find, indeed, that the cases were quite low. Just putting things in perspective, you have a greater chance of getting a blood clot by flying on an airplane. If you take birth control pills, you have a greater chance of getting a blood clot. If you're pregnant, you have a greater chance of getting a blood clot. And most definitely, if you have the COVID-19 infection, you are at a much, much higher risk of getting a blood clot than if you take the Johnson & Johnson vaccine. That being said, now that we know, even though it was a very rare chance, and after all the data was looked at, we think there is a two in a million chance approximately, we still find that the benefits of getting the Johnson & Johnson vaccine far outweigh the risks, even in dialysis patients. Everyone does need to consult with their physicians to find out, because if you have a high risk of blood clots, or if there's some other reason, then you definitely want to consult with your physician. But in general, we are still recommending that the Johnson & Johnson vaccine, if that is a shot that's available to you, we do find it to be safe. And just understand that what we found, but it's mostly ladies less than 50 who had this very, very, very rare blood clot.
Okay. Thank you so much. As we're waiting for questions to come in, and I see that a few are right now, I wanted to just kind of step back for a minute. Gary, you talked about pandemic fatigue. Would you please speak to us about any anxiety that people may have as we open up as a society? So that's kind of corollary to what you mentioned, but let's talk about that.
Yeah, thank you, Lorna. Sometimes it feels like we can't win, so here we are, the world has come together and we have these wonderful vaccines available to us. We have hope on the horizon. And now we are planning ahead. And sometimes when we're planning ahead and not living in the moment, which is really about mindfulness, we plan ahead and it causes us to have anxiety. So I'm seeing articles about preparing for post-pandemic times. And in some ways, I think that heightens our anxiety and makes us feel uneasy about another level of uncertainty. We've been living in this uncertainty for a period of time now. And instead of going back to the way things used to be, things are going to be different. And we know that. But when we start to think about, overthink it, then we can go down different rabbit holes, and we can have narratives that can cause us to have even more anxiety. Sometimes we catastrophize. We tend to cling more to negativity than positivity, and so it might cause us more angst thinking ahead instead of just going with things, letting things be, and letting go of our expectations, and doing that with kindness and gentleness towards ourselves in the process.
Okay, excellent. And those are tips and perspectives that are relevant to the general public, right? Not just our kidney community. So thank you for that. I'm going to go now to one of the questions in the chat room. And this viewer says, I have a transplanted kidney and I take anti-rejection medications. I received notification that I did not develop antibodies post the Pfizer vaccine. Does everybody develop antibodies with the vaccines? And does no antibodies mean that I don't have the 95% protection?
That is such an excellent question. Now, for patients who are on immunosuppressants, again, I stress, we are still recommending that they get the vaccines. And of course, you want to be sure you discuss this with your nephrologist and your transplant nephrology team. Everyone is different in the way that they produce antibodies, and patients who have transplants or patients who have immune compromised states, patients with autoimmune diseases or on medications that suppress your immune system, their antibody production may not be the same as everyone else's, which is why I made the point at the beginning that the vaccines are not 100%, and they don't mean that you have 100% immunity. They just add an extra layer of protection. The good news is this. Antibodies, what you hear us testing, that's something that's relatively easy for us to test, but antibodies are not the only part of your immune system. In addition to your body making antibodies, you have all kinds of other cells. You have T cells, you have B cells, you have just a very complex immune system. And so even if your antibodies are not what one would have expected, you may still have good T cells, you may still have different cytokines, different parts of your immune system that will help you to be protected against the virus. But again, it's very important that you get the specific medical advice from your transplant nephrologist, your nephrology team. And some patients, I'm even recommending to go to an allergist or an immunologist to really kind of get the nuances of what you may need to do to maximize your protection. Meanwhile, continue to wear masks, physically distance, and understand that as a transplant patient, which I know you already know this, that your immune system is a little different, a little more compromised than the rest of us as you've gotten that wonderful gift of life, the transplant. And so you have to make sure that you advocate for yourself and you protect yourself. And what you do for protection may be a little bit different, a little more stringent than what your neighbors may do. But in short, it does not mean that you don't have protection. You may still have some of the other parts of the immune system working, but you want to consult your nephrologist, your transplant team about what you specifically should do.
Thank you so much, Dr. Frieda. And in addition to that wonderful answer to the question, I appreciate that you pointed out that, we all should recognize that vaccination does not mean immunity. And I think sometimes that gets lost in the translation. So thank you so much. I'll go to one of our other questions. And this one says, is it appropriate to ask my primary care physician to order a COVID antibody test for me to find out if I have sufficient antibodies after being fully vaccinated after 6 to 8 weeks?
In general, that answer is no, and I'll tell you why. At this point, we don't know how much the quantity of antibodies correlate with the quality of antibodies. In other words, you may have, 10 times the antibodies of your neighbor, but that doesn't necessarily mean that your neighbor is not protected. Perhaps your neighbor has some antibodies that are going to last for a very long time. So it won't really necessarily give us great information. And anytime we as physicians, if we do a test, we want to know that it's going to give us some type of a definitive answer. Now, that being said, if you're in a special situation where, say you take a medication say you have an autoimmune disease and you take a medication that suppresses your immune system, and there's a certain timing of the month that your doctor knows that your immune system is suppressed, and perhaps your doctor is concerned that you didn't have enough immunity to mount the B cells or to mount the antibodies. In that specific situation, perhaps your doctor will want to do an antibody test, but in general, we don't recommend getting an antibody test just to see if you got immunity. We've done the trials. We initially, with the Pfizer and Moderna, had over 70,000 participants, and then with the other vaccine trials, over 100,000 participants. And now in the US, we have well over 200 million shots, and we are seeing that the vaccines work. And so, no, it's not something that's necessary in general to do.
Absolutely. Thank you so much for that. And so, Gary, as patients, sort of deal with these kinds of issues, is there any guidance that you can provide to help them at least, mentally be prepared to confront those concerns?
Yeah, I think that, I think that it's helpful for people to be able to take what I call a purposeful pause, an opportunity just to kind of stop and check in using all of your senses. And again, that's really what mindfulness is all about, paying attention to the present moment, using all of your senses. So asking yourself, how am I feeling at this time? What's happening in with my emotions, my thoughts? Are they stormy? Are they calm? What's happening in my body? And then using all of those pieces of information, as I said, to make wise decisions. That stopping and opportunity to see things more clearly helps us to reframe our situations, and we become less knee-jerk and less just acting on default. And because of that, I think we can have more of a sense of calmness, but also more confidence in our decisions. So something that could be, there's a practice called STOP, which is a mindfulness practice. It's an acronym, basically stop, turn to the breath for a moment, observe, and then proceed. Something as simple as that can help you just to have some grounding to go forward.
Well, I appreciate that because we all know that in COVID-19, there are many people who've been isolated for a very long time and don't have the benefit of family or friends to connect with and share those feelings. So you just touched on one, but are there any exercises that one could do at home to relieve some of that stress and anxiety?
Yeah, there's an exercise, a mindfulness exercise that I find very helpful. It's called the body scan. It's a good exercise at grounding you. So basically, it's just sequentially starting from the top of your head or from the tips of your toes, and just dropping your awareness into what's happening in that part of the body. So you're not trying to change it or alter it. You're not wishing it were different, but you're just noticing. So noticing if the bottom of your feet have warmth, coolness, tingling, numbness, and then going to the top of your feet, to your knees, your hips, your abdomen, your fingers and your hands, the top of your head, and then being with your body in its full totality as a living, breathing organism. Something like that is a very good grounding exercise. People find it helpful as well to do it first thing in the morning, just to kind of check in with the body, and also to help as far as settling thoughts and grounding before bedtime. So that's just one exercise. Another simple exercise is you can be in a lineup at a grocery store, probably with a mask on, and or maybe with a lot of people that aren't very patient. But you can check in again or bring your awareness to the soles of your feet. And by just stopping for a moment and checking in and noticing what's happening at the soles of the feet, again, that's a good grounding mechanism. So sometimes when we have these exercises, which are mindful in their roots, it can help us to come back to this moment and not be worried about tomorrow, and not be thinking so much about the past or hanging on to. We suffer when we try to hang on to the past, or when we try to push away something. So being in the moment is really what it's all about.
Okay. Well, thank you for that. It reminds me of the conversation we had before we went live, where we were discussing, one of the benefits of us having been isolated and staying in home and, not having the distractions of our normal life, is that it allows us an opportunity to really get in tune with our body and how we're thinking and how we're feeling. So thank you for sharing that information. I'm going to go to another question now. Let's see. Let me go back up. Okay, this one says, I'm concerned about the efficacy of the vaccine on transplant recipients, and if there might be something in the works to help us get to a higher percentage of immunity. Dr. Frida, do you want to address that?
I do. And that really is such an important point, because it is true. Patients who have kidney transplants are on medications that purposely push their immune systems down, cause them to have some immunosuppression. And so if you're constantly taking medicines that are suppressing your immune system, then you take a vaccine that's supposed to build up your immune system, will you still have some immune compromise with the vaccines? And the answer is, because this is so new and it is so short term, there is a very real possibility. Now, what we do know in weighing the benefits and the risks is that the vaccines are safe in our transplant patients. But at this point, we're still doing studies, we're still paying attention, we're still taking note in transplant populations to find out just how effective the vaccines are. Right now, it's the best thing that we have, and it certainly gives you more protection, definitely gives you more protection than if you had no vaccine. But as far as that data and other vaccines and boosters, these things remain to be seen. You may have heard that the major vaccine companies like Pfizer and Moderna are looking into already making boosters. Now that's for the general population, trying to anticipate some of the variants and seeing if we need to tweak the vaccines to change the variants down the road. But in that same thinking, there very likely in the future will be some tweaking or decisions on whether or not transplant patients need boosters, or if they need, a different schedule. Unfortunately, this is the novel coronavirus, and so it's dynamic, it's fluid, it's ever changing. So we don't have those answers yet, but that's certainly an excellent question, and it's one that I would pose over and over to your primary care physician, to your nephrologist. So as soon as we get the data, as soon as some of these studies are coming down the line, you will be one of the first to know what's going on. Really great question.
Excellent. Thank you so much. And before I go on to the next question, I really just want to encourage you, viewers, to please submit your questions in the chat room. We've got two outstanding panelists here today who are eager and ready to answer all of your questions. So please put those in there for us. Please do that. So the next question is, let's see, we just lost it. Let me go back. Okay, just one moment. When should we expect to see the studies or the data referenced about the COVID vaccine and transplant recipients?
That's a good question. I do not have a good answer. I don't know at this point when those studies will be completed. I don't. But what I do know is that with the CDC, we have these various websites, and you can go to the CDC website to look where they are constantly doing the safety monitoring when people have issues, whether you have transplant or any other illness, or if you're perfectly healthy, if you have any kind of issues with the vaccine. That's kind of a moving document, something that's live and notes being taken on what's going on. But at this point, there is no specific deadline or timeline for studies in transplant patients. So again, with this novel coronavirus, it's something that we're going to have to sit and watch day by day. But again, what we do know is that the vaccines are safe. As far as the other minutia and the fine tuning, that just remains to be seen.
Okay, thank you. Thank you. Let me see here. And again, waiting for you all to put your questions in. You've got these experts right in the palm of your hand. So please take advantage of them. I'll tell you what, while we're waiting for some more of those questions to come in, Gary, why don't you talk to us a little bit more about how has mindfulness emerged, as a topic for consideration as we deal with kidney patients?
So mindfulness has been around for a long time, but it really gained popular attention around 1979 with John Kabat-Zinn's work in America. And as far as work with kidney patients, I instituted mindfulness programming at the dialysis program where I worked for 13 years here in Sudbury, Ontario. I found it really helpful as far as helping people to be less worried. And again, as far as just helping with clarity, seeing things as they are, as opposed to misperceiving things or letting that ruminating mind run wild and often go down these rabbit holes that never materialize. Also, as far as clarity and concentration, just being more able to focus. And then most importantly, with something called equanimity, which is really being with the full pleasant, unpleasant, and neutral circumstances of life. And we all know it with COVID, but certainly a diagnosis of chronic kidney disease and pre-dialysis, leading to dialysis, leading to hopefully transplant, has demonstrated that life changes at the drop of a hat, and we have the resources to cope, and we have the innate ability to weather these storms. But sometimes we lose sight of that. So mindfulness helps us not to be totally overwhelmed with change or circumstances beyond our control. When you're first put on dialysis, things are very much out of your control, and but people adapt, and so mindfulness is a great tool for helping to be in the moment and to be less overwhelmed and not to drown in it with the changes.
Okay. Thank you so much. Dr. Frida, you touched on this a little bit earlier, but one of the questions that I see in the chat room is whether there is a particular vaccine that is best for those who've had a kidney transplant.
At this point, all three vaccines are safe. We recommend all three unless your physician specifically has a reason. If you have an allergy to a particular component within a vaccine, then that's something for you to speak with your physician about. If you're someone who has had severe allergies, not just, food allergies, not just even having anaphylaxis to something outside of the vaccine, but if you've had severe allergies to components within the vaccine, or if you're a person who is at a particularly high risk for blood clots in general, you'll want to talk to your physician about what is recommended for you. But as a whole, we are not recommending one vaccine over the other for our kidney patients.
Okay, thank you so much. The next question is, considering the fact that Hep B virus can cause CKD in the long run as a result of the virus being attacked by the immune system and getting settled in the kidneys, can a live virus found in the COVID-19 vaccines cause CKD in the long run?
Very important. Oh my goodness, that's such an important point because the answer is no, and there is no live COVID-19 virus in the vaccines. But this is a very common misconception, and so I'm glad this point was brought up. Let's talk about the messenger RNA vaccines, the Pfizer and the Moderna. There is no virus at all. There's no dead virus. There's no live attenuated virus. There's no weakened virus in the messenger RNA vaccines. What you have is genetic material, that messenger RNA, and what it does is it sends a message to your body cells to start making a copy of the spike proteins. And it kind of is tricking your body into thinking that it's been exposed to the coronavirus, but really it's just exposed to the spike protein that your body makes from the messenger RNA, which cannot make you sick. And so you absolutely cannot get the COVID-19 infection from the vaccine. Now let's take the viral vector. That probably sounds a little scarier when you're talking about hepatitis virus. And now with the Johnson & Johnson, you know it's a viral vector. Well, they've taken an adenovirus, which is weakened to the point where it cannot replicate. It cannot make you sick at all. They've taken away its ability to divide and replicate and conquer. All it is a vector. It's just a little passage, like a little boat that takes that material, that genetic material. So again, your body can make that spike protein, recognize it. And so then the next time you're exposed to perhaps the real coronavirus, your body thinks that it's been exposed before, your immune system is already revved up, it's ready, and it attacks. But the important point is there is no live virus, no real virus that can hurt you at all in the vaccine. And so no, the vaccine cannot give you CKD.
Excellent, thank you. And so sort of related to that, this question asks whether or not, let's see, let me go back to it, it's skipping around here. Are there any studies underway to evaluate the long-term effects of the vaccines on kidney patients?
We have so many studies that are underway in just simultaneously in conjunction. We're looking at kidney patients. We're looking at patients with neurological diseases. We're looking at pregnant patients. We're looking at women. We're looking at diabetic patients. We have all types of studies. But as far as being able to enroll in the specific patient as a kidney disease person, I'm not aware of any general enrollment that is underway. But again, if you have gotten the vaccine, which hopefully you have, just be very mindful of what's going on with your body. And if you have any symptoms, especially after you first got the vaccine, I do want you to go to that CDC website and report them. But there's studies that are coming down the pipe, but as far as one specifically that you can request to enroll in, I'm not aware of one at the time. But if you go to that CDC website and you search, then you can find some information on studies that are coming up, and the NIH as well.
Excellent. Thank you so much. And so, Gary, if anyone watching today is interested in identifying a mindfulness professional, how would you recommend they go about that? What kind of resources are available?
I would suggest that you look for resources related to something called the Mindfulness-Based Stress Reduction Program. That's John Kabat-Zinn's work. It is the most evidence-based, rigorously studied mindfulness training available. It's an 8-week program comprised of about 31 hours of instruction by certified teachers. You can gain access to those that are qualified or certified to teach through Brown University. If you go to the Brown Center for Mindfulness on the internet, there is a list available of credentialed people to teach mindfulness all over the world. And I really think it's important to get somebody that is credentialed because there are risks associated with mindfulness. You know, if you're in the depths of despair or you have untreated depression, it may not be the best time to be with what is, which is really what mindfulness is all about. Or if you're in the early stages of addiction withdrawal, it might not be in your best interest. So an expert who is trained to facilitate mindfulness-based stress reduction would be a good resource to find out what's available in your community.
Excellent. Thank you. We talked a little bit earlier about anxiety as the world opens up. And so one of these questions relates to that somewhat, asking that you respond to, since transplant patients have a lesser response to the vaccine, what recommendations do you have to keep them safe? Are there other extra protocols that they need to observe, again, you know, given their condition and increased exposure publicly?
Yes, I believe that the transplant patient should be still quite vigilant about wearing masks, socially distancing, and really maintaining all of the hygiene. Now, that being said, we know that from the CDC's early recommendations, if you are dealing with other people, like say one household of fully vaccinated people, we know that they can visit people as long as they're at low risk, even if that other household or one other household is unvaccinated. And so if you are around people who have recently tested negative, they're in your household, and certainly if they're fully vaccinated, then perhaps, if you're fully vaccinated, then you can follow some of those CDC guidelines as far as unmasking. But remember, there is that little caveat. The CDC says that when you're dealing with people who are at low risk for complications, and if you are a person who's a transplant patient and you're immune compromised by nature of taking those medications, then it's going to be important that even as the world opens up, even as you see people slinging their masks to the side, it is at this point prudent for you to keep your mask on most of the time, certainly indoors, and certainly if you're close to other people, even if you're vaccinated. Being vaccinated does provide you with an extra layer of protection, but as we're discussing, we don't know the exact percentage and just how much. And so given this pandemic and the different surges that we see around the world, you want to err on the side of caution and wear those masks.
Absolutely. Thank you, Dr. Frida. Another question. This viewer says, I've been on PD for 3 years now, and I'm currently working towards a transplant. I've been afraid to get the vaccines because of my immunodeficiency. Should someone like me worry about that?
Well, first of all, congratulations on your journey for getting a transplant. And I really do hope and pray that you get this life-saving gift of life as a transplant. But just like you said, someone who is immunocompromised like you, should you be worried? Yes, you should be worried. Not about the vaccine. You should be worried about COVID-19. We know that patients who are on dialysis, patients who are on PD are more likely to contract COVID-19. And now that we have these new variants on the rise, like the B117 variant that was first identified in the UK, we know that these new variants are even more transmissible, more contagious. And in some cases, we believe that they're actually more deadly. And so the fear you should have is not of the vaccine, it's of COVID-19, and you should get vaccinated.
Excellent. Thank you. And so this question asks, if we do take the vaccine, I'm a CKD stage 3 patient, could it actually attack the kidneys?
No, the vaccine cannot attack the kidneys. So again, even before we got to the well over 200 million doses in the United States, even before we got to the, around 32% of the Americans who are fully vaccinated, even before that level, just in the studies alone, we're dealing with about 100,000 study participants. They monitored their labs, they monitored their kidney function throughout, and we did not find anyone who developed CKD. And the studies actually really started over a year ago, back in March 2020. So now we're looking at a year data from the people who first started getting the vaccines, and we have not seen any evidence of renal failure, chronic kidney disease being a cause of vaccines. And so at this point, it looks like the vaccines are safe in that they do not cause chronic kidney disease, CKD.
Excellent. Thank you so much. And Gary, as I'm listening to these questions, I'm thinking about the connection to, physical health and mental health. Do you work with nephrologists in providing, sort of a collaborative approach to care for kidney patients?
So I'm no longer providing service in a nephrology program. But when I was providing service, I had a lot of great support by the nephrologists on my team. And they would ask me to work with patients around anxiety, a safe place visualization. In one instance, I was able to go into a surgical suite where a person had to have fistula revision, and they couldn't go under general anesthetic, but I did the body scan with them to keep them relaxed and calm so the procedure could occur. So yeah, I had great support by the nephrologists on my team here in Sudbury, and I'm very grateful and thankful for that. It really helped me when I started my journey as far as mindfulness, I thought it was all about gaining tools to help my patients. But again, as healthcare professionals, we need to help ourselves too. So it also helped me to deal with my own anxiety and the tiredness and the fatigue that comes with listening to people that are suffering and working with these sad stories and situations all the time. Working with healthcare professionals, working with patients, and great support by the nephrologists on my team here.
Excellent. Thank you so much. Our next question, who is the most appropriate doctor to talk to about my husband who has stage 4 CKD getting a shot? His general doctor or a nephrologist?
I would say that probably both the general doctor and the nephrologist will both have adequate information and be on the same page about the vaccines. Now, we do know that most people are seeing their general doctors if they have chronic issues, maybe every few months, if they have chronic issues that need to be addressed. But if you have CKD4, then you should be seeing your nephrologist every month. That being said, your nephrologist will probably have more of the up-to-date information about you and what's going on with your kidneys, but you should certainly discuss it with both. But as far as who can give you the most information specific to your kidney disease, the CKD4, probably nephrologist.
Okay. Thank you so much. I want to give both of you an opportunity to sort of make some last statements, a few minutes before we have to close out. And I want to remind the viewers that if you've entered questions or you desire to before we end this presentation, please go ahead and do that, because we will get to them and answer them in the chat room. And as well, you can always go to our National Kidney Foundation website for more information at www.kidney.org. So, Dr. Frida, why don't you kind of give us your last perspective and information advice that you can provide to our viewers today?
Yes, this pandemic has been such a scary time, really. You know, it's just been over a year since we've been hit by the pandemic, and then now we've got the vaccines, and then information seems to just keep changing. So I really want to encourage everyone who is listening, kidney patients, non-kidney patients in general, just make sure that when you're getting your information, you follow the science, you speak to your physicians, healthcare workers, speak to people you trust, and get adequate evidence-based information. I do recommend the vaccines in kidney patients, in dialysis patients. We know that COVID-19 can be devastating. It can cause death. And death is not the only consequence of COVID-19. It can cause you to be a long hauler or have long COVID, where you can have blood clots, neurological disorders, depression, brain fog, you name it. And so definitely the benefits of the vaccines outweigh the risks. That being said, you certainly want to have a conversation with your physician. What we say here has been wonderful information that we've shared from places of evidence, from helpful places, but nothing actually replaces the recommendation of your personal physician. I also want to say that I spend a lot of time answering questions about COVID-19. Yes, I am an active nephrologist, but I've also been board certified in nephrology, in internal medicine, and in pediatrics. And so if you go to my YouTube channel, Dr. Frida, I have more information on COVID-19, on vaccines, and just some other general health information, including CKD, dialysis, hypertension, things of that nature, which could be a helpful resource.
Okay. Thank you so much. Gary, do you have any closing comments for us?
Yeah, I would like to say that we really can be participants in our care and our well-being, and we do have the tools and the inner resources to get through this. A couple suggestions. There's something called doom scrolling. So watching your what you're scrolling through on the internet, and just watching your the news that you're being subjected to. If it feels yucky inside as you're reading it, pay attention to your body and what's happening in your feelings, your thoughts. It may not be in your best interest to be visiting it as frequently. Get outside, get some fresh air. Sometimes a walk around the block, or as my wise wife often says, a cup of tea can do you wonders. And also staying away from your devices around bedtime, talking to people about how you're feeling, and not in a with toxic positivity where you're always saying, yeah, oh, I'm going to be a lot better person because of this, and this is a gift and all that kind of stuff. But allowing people to really talk about their feelings, and then allowing them to have some hope about the future. Return to some of your previous loves of life, maybe reading, going back to books before bed, and setting boundaries in your household and in your work activity. And again, just knowing that the nature of life is that we will have rainy days and sunny days. I'm a runner, and I snapped these signs one day. And that really is the essence of life: rainy days to come, sunny days ahead. And we just keep going back and forth. And really, just when we think that we are confident about how we are in life, something happens. And that will be the nature of life. We know that more than anything else. So knowing that we have the inner resources to deal with this. Most importantly, taking a purposeful pause, and just going to the breath, or going to anchors that will ground you when you have that opportunity.
Fantastic advice. And again, advice that's good for all of us, So thank you both. This has been a wonderful conversation. I appreciate you all so much. And to our viewers, thank you for joining us today, and thank you for your questions. And I remind you again that if we did not get to those, we certainly will. So thank you all so very much for joining us. And I look forward to another opportunity like this very soon. Thank you so much.
Thank you.
Thank you.